Welcome to the final video in our 5-part series on the framework to design, test, spread, and sustain effective practice in child welfare. Our first 4 videos describe the 5 phases of the framework and how they can serve as a practical guide for building evidence and spreading evidence-based practice.
We covered a lot of ground in those previous discussions, and in this video, we'll tie it all together.
We're going to look at one example of a child welfare policy intervention that is spreading and continues to improve, in large part because it has successfully cycled through all 5 phases described in the framework.
We've invited a colleague of ours to talk with us about the Guardianship Assistance Program, or GAP. Joan has studied subsidized guardianship and how GAP became a national program with 33 state and tribal participants. Welcome, Joan.
Thank you.
I'm guessing that GAP has really evolved over time. How did it all begin?
Well, back in 1993, a state's Department of Children and Families had a problem. This state had experienced enormous growth in its number of kids in foster care that were being cared for by relatives, like grandparents, aunts, and uncles.
That sounds like it could have been a positive thing. Why was it a problem?
Well, many of these children were already living with relatives, often as part of informal family arrangements, before they came to the attention of the child welfare system and entered state custody. These so-called non-removal cases didn't qualify for federal reimbursement of relatives' costs for things like food, clothing, shelter, and transportation. The state was solely responsible for these subsidies. In other states at that time, only licensed relative caregivers were eligible for full foster care benefits. But this state's policy required that all relative caregivers be paid full benefits, the same as licensed foster parents. Between the growth in kinship care and these subsidy policies, the state simply couldn't afford to provide long-term financial support to so many relatives, most of whom were unlicensed.
So what did the state do?
The state asked a university evaluation team to partner with it to explore why relative care was increasing and to develop a sustainable kinship care program that the state would be able to afford.
So it sounds like the state had already identified the problem it wanted to work on when it brought in an evaluation partner to help explore it further.
Exactly. If the state had chosen a solution before it had really studied the problem, the solution probably would have missed the deeper issues that needed to be addressed.
So what happened next?
Well, early on, the evaluation team tried to understand why there was so much growth in the relative care population. As a result of looking more closely, it linked the growth in relative care to the lack of subsidized permanency options for kin, and the inability of relatives to afford taking care of their grandchildren, nieces, and nephews without help. The team theorized that this loss of financial support, if the children left foster care, kept too many kids unnecessarily in the system. After the state understood the problem and started researching solutions, one of the toughest questions it faced was how to support relative care for children, while also trying to promote permanency for these children, to move them out of foster care.
That was a problem for many states back then. In the 1990s, many child welfare agencies felt like they only had 2 options: either reunify children with their birth parents or keep children with their extended families, treating this as a form of family reunification. In either case, all foster care support from the state ended at reunification, and families had to turn to welfare for assistance.
And at that time, asking members of an extended family to adopt a child didn't seem to be an option either. In people's minds, adoption was something that non-relatives did with babies. Terminating parental rights of mothers so that grandparents could become the moms and dads of their grandchildren ran against the grain of what people considered the right thing to do. It took a long time for attitudes to change and for people to recognize adoption as an option for older kids as well as for relatives.
You're right. And this meant that a lot of children in this state were in kinship care with no easy path out of the child welfare system. The state eventually found its solution. It created a new program that delegated partial decision-making authority to relatives in a guardianship-like arrangement for kids. This solution cut administrative costs while keeping legal custody of children with the state. This hybrid arrangement also preserved children's eligibility for federal foster care support that helped to offset state costs. It took 2 years for the state to develop, implement, and conduct formative tests of this program. And even though it was developed from a theory of change that was built on research evidence, it was a flop.
I guess I wasn't expecting you to say that.
But that's the important thing about doing early evaluation of an intervention. In this case, the state really did need to see whether or not the intervention worked before investing in full implementation. The program didn't work, but the state and its partners learned a lot and gathered important data.
That must be when the state decided to pursue making kinship care placements legally permanent.
That's right. The state decided to experiment with transferring full legal authority to kinship caregivers, either through legal adoption or guardianship. Fortunately, in 1995, the federal government was also interested in testing subsidized guardianship. It wanted to see what would happen if a child's custody or legal guardianship was transferred to relatives and the child retained eligibility for federal support through a guardianship assistance subsidy. The state took advantage of a special waiver offered by the federal government to develop and test a new subsidized guardianship program, this time transferring legal custody from the state to the relative caregivers. The state hoped the program would be less burdensome and costly than keeping children in long-term foster care.
So the state went through another round of development and formative testing and then moved into the compare and learn phase.
Of course, it wasn't conscious of following the 5 phases of the framework, but the waiver provided a perfect comparison opportunity because the state and a few others were able to conduct rigorous evaluations of their guardianship programs to see if they would increase rates of permanency for children overall, without adversely affecting rates of reunification and adoption. They also hoped to see reductions in the length of time children and youth were in foster care. At the end of the 5-year evaluation, results suggested that the state's subsidized guardianship program was able to increase permanency, maintain reunification rates, and save the state millions and millions of dollars.
The comparison verified the effectiveness of the program's core components and the state's theory of change.
In the second round of federal waiver applications, a number of states attempted to replicate the subsidized guardianship program and its results. 2 of those states were able to refine the program and boost permanency rates even higher. This evidence made a convincing case that subsidized guardianship could achieve positive results and be effective when spread to other states.
In 2008, the Congressional Budget Office scored the program as a cost saver, and the Fostering Connections Act established the Guardianship Assistance Program. As of July 2013, 30 states, Washington, D.C., and 2 tribes had been approved by the federal government for GAP funding.
It's important to note that for child welfare systems that are interested in implementing GAP, it's not as simple as taking another state's program and starting to practice it in the same way.
As we've discussed in previous videos, a lot of different factors influence what intervention or solution is chosen by an agency.
For example, the program models that have been implemented and rigorously tested by states probably weren't developed with tribal culture and context in mind. A tribe, or another state for that matter, may need to adapt one or more aspects of the program to make it fit for its population and system.
So what you're saying is that sometimes when we're adapting an existing evidence-supported practice, policy, or program, we may be able to implement it without much adaptation, but sometimes we may need to make some major changes.
Yes, and if major changes to a proven model are needed, this means that a state or tribe should go through the develop and test phase to define its core components, and then to compare and learn to rigorously evaluate whether the adapted program improves permanency outcomes in comparison to the alternative.
After a state or tribe has fully implemented a proven model and integrated it into its routine practice, then its focus shifts to monitoring the practice of subsidized guardianship in the agency and improving its implementation to sustain permanency outcomes.
This is exactly where the state in our example currently is with GAP. It routinely collects and analyzes data about its subsidized guardianship program, uses data to improve agency practices, communicates findings from data to increase agency-wide understanding about the policy's effects, and investigates who benefits or doesn't benefit from the program and under what circumstances.
Coincidentally, this process of collecting and routinely reviewing administrative and program data to improve performance and monitor outcomes was probably what the state was doing back in 1993, when it identified such large increases in its relative care population of children. And the process of continuing to improve on subsidized guardianship may lead it to another problem-solving effort in the future.
This story really reinforces the importance of partnerships between child welfare administrators, funders, and evaluators. And it showed how subsidized guardianship and the evolution of GAP mirrored the major steps in the framework. Every day, child welfare systems rely on practices, programs, and policies to improve the safety, permanency, and well-being of our children and their families. But all too often, we don't know whether and how these interventions are really making a difference. We're missing important opportunities to evaluate, to partner, to learn, and to make more informed decisions.
The framework to design, test, spread, and sustain effective practice in child welfare was developed to help us take more deliberate steps to tackle this challenge together.
It's been helpful for us, and we hope it will be helpful for you.